please welcome to the stage CEO of the African American Leadership Forum, Dara Beavis.
Good evening. You all can hear me okay? All right. Well, before I welcome you, let me begin the way we always begin at the forum. And that is by calling in the names that we cannot see, our ancestors, the ones who make it possible for us to be here in these bodies, in this room, on this night. We do not begin without them. And tonight, I am carrying two names especially close. My great-grandmother, Ada. Ada owned a brownstone in Washington, D.C. in the 30s, 40s, and up to the 70s, just steps away from Capitol Hill. So while power was being debated blocks from her house, she was practicing another kind of power. Ada turned her home into a place where elders could be cared for in their last season of life because she did not trust that nursing homes would care for us the way that she could care for us. You hear what I'm saying? So before I was even a thought, or as my mama says, itch in your father's pants, or before I had language for this work, Ada had already made a home into an institution of care. And I am named after Ada's child, my middle name, Irene. So Irene served as a hospital administrator for 30 years in Arlington, Virginia. For 3 decades, she helped make the machinery of care move. The coordination, the details. She determined who and how and whether people would be seen. Her team cried when she retired after her 30 years. She would make it possible for families to be held who looked like us. So while Ada made a home into a place of care, Irene helped make a hospital into a place that could care. So tonight, standing before you for the first time as CEO of the forum, thank you, y'all. Y'all know I'm a crier, so y'all gonna have to keep that down. I don't feel like tonight I am beginning something. I feel like I'm answering something. And it's a call that was already moving through my family line. And I know, because I've hugged about almost all of y'all, that it has been moving through your family as well. And that call, as you know, is a call to care for our people with dignity. It's a call to build places where our elders are not discarded. It's a call to understand health not only as a system we enter when something has gone wrong, but as a sacred agreement we make with one another. So we hold this moment of acknowledging our ancestors with both hands, and I'm not doing this alone. So I'm going to ask you on 3 to bring your ancestors into the room with us tonight. I want you to think of the ones who carried you, your grandmothers, your grandfathers, your aunties, uncles, neighbors, the ones who worked those herbs or those roots, those ones who had your name on their lips in their prayers before you were even a name that you knew. I want you to say their name out loud on 3, or you can hold it quietly, but I want you to bring them in because they belong here tonight. Let them hear what they have made possible on 3. 1, 2, 3. Ada, Irene, Phoebe, Barbara, Pam. Ashe. Now I'm gonna take you back. Y'all know I'm a publisher, storyteller, and writer, so I can't help myself, so bear with me. Let's go to the year 1721. So 1721, We're in Boston, and Boston is terrified. Smallpox is ripping through the city, okay? It has attacked neighbors. It's come for the babies. It's come for the elders. It's come for the neighbors. And in this city, there is an African man. Now, I know I'm speaking to people who are in health, so I know y'all know this story, but bear with me. There's a man by the name of Onesimus. Who's heard of the name Onesimus? I knew you would know, Dr. Squires. Onesimus is enslaved. Onesimus in 1721 is unfree. He is denied even legal claim to his own body, but he is carrying something that the law cannot take from him, and that is his memory. So as smallpox is ripping through Boston, the man who claims to own Onesimus is the man is a name, see, because he's a slave owner, I can't say his name. It's a man by the name of Cotton Mather. And so he asked him one day if he has ever had smallpox. And Onesimus says something like, well, yes and no. So Cotton Mather is confused. He says, what you mean, yes and no? Onesimus explains, well, where I come from, the elders do not wait for death to decide the future. They take a little bit of the illness and they place it in the skin. The body learns the danger. The body remembers, and when sickness comes again, the body already knows how to live. Y'all hear that? Can you imagine what it took to say that, to stand in a world in 1721 that had stripped you of your freedom, your personhood, your name, your protection, and still say, I know something that can save you? Some called Onesimus mad. Some called it dangerous. But some could not believe that wisdom could come from an African mouth. And then Onesimus saves hundreds upon hundreds of lives and becomes the seed that today we call inoculation. Sit with that. Before Boston had anything that we could recognize as a modern health system, a captive African man was carrying a wellness technology in his memory. Before the city could honor his humanity, it needed to know his knowledge. And I know that there are several of you in this room who are holding that feeling of not knowing if a system can recognize your humanity while you are saving hundreds upon hundreds of our lives. Black health innovation is not new. It is ancestral. It lived in Onesimus. It lived in Ada's brownstone. It lived in Irene's work in more than 30 years of coordination, stewardship, and quiet devotion. And it lives in us. Before we had charts and portals, we had grandmothers who could recite everybody's pressure and everybody's sugar from memory. They were our first medical records. And so when our grandmothers and our aunties and our grandfathers and our uncles say, baby, I've carried a lot and I'm still here, we must hear them correctly, because they're not talking about survival. They're telling you about the medicine they've had to use to get you here. Their stories have helped us live. And that lineage is not only behind us, it is in these seats, and it's in the names that you have just spoken. So I'm going to ask you to do one more thing. Many of you already know what I'm about to ask. If it is accessible to you, please stand. If it is not, you can raise your hand. But I want the elders, the caregivers, the healers, the practitioners, the yogis, the organizers, the advocates, the dreamers who feed our wellness with your hands, your work, your body, your practices, your research. We call you our stewards, and it's because you are stubborn. You refuse to let our people walk, work, or exist unwell. Please won't you stand or raise your hand? I'm looking to see if there's people who are not standing who I think can stand. Thank you so much. I want you all to note who stood. And I want you to also celebrate that that is what our future looks like. And it is well because of those people who we just clapped for. And I don't want you to forget that they need more than just claps. They need your support. They need to be asked, what do they need to be well? And we need to hold them up. Thank you, Dr. Squires, for asking if you can come to my house and do yoga with me every single month. I want to take this time to thank our board who carry this vision of radical Black futures. Thank you. I want to thank Bukata Hayes, who serves on our board and stands inside this work with us. Thank you, Bukata. And I want to thank Blue Cross and Blue Shield of Minnesota. You do not simply sponsor an evening. You chose to invest in a future for Black health. And that is because Bukata Hayes is unapologetically insistent that Blue Cross does that. I also want to embarrass my amazing team at the African American Leadership Forum. You all are the most brilliant, beautifully blackety-black, brilliant team that a CEO could ever have. And I know that so much of what you do is not only sacred, it is also unglamorous. And I thank you for that work. I'm not going to ask y'all to stand. Do y'all want to stand? They want y'all to stand. And over here too. Thank y'all. And before I wrap, I just want to say a few parting things. Black health has never only been the absence of harm, although America loves for that framing to be our narrative. At the Forum, we believe that Black health is also the presence of our beautiful Black joy. It's also the right to grow old. It's the right to rest. It's the right to have our last seasons met with dignity and our first seasons met with protection. And I thank all of you in this room who are doing that holy work, because Lord God is holy. You have decided that you are not just here to manage decline, that you are designing abundance for this Minnesota. And so tonight we have two visionaries who are here to help us see that path ahead. Now, I had the amazing opportunity to have food at Classics last night. Shout out to Classics, they were amazing. With the incredible Dr. Uché Blackstock, and you all are in for such a treat. You just know when you meet someone and their light is just light and it's bright, and they have those two letters, doctor, before their name, and they don't carry themselves as though that is who they are. They carry themselves as though they are in this space for us, through us, with us, and by us, and that is Dr. Uché Blackstock. Dr. Uché, thank you for being here with us tonight. And she is here with my incredible sister friend, mother friend, friend. Dr. Nneka Sederstrom. And yes. And Dr. Nneka has been with the forum for 6 months as our Afrofuturist in residence, focused on health equity and justice. And what I can tell you about Dr. Nneka Sederstrom is that she is a mighty, mighty design from the one who lives above. And I just thank God for who you are, for what you are, for what you do, and for how you have saved so many of us behind the scenes, not even asking for much acknowledged. And so I just want to say thank you for all that I call her the Harriet Tubman of healthcare. Thank you. The future does not arrive on its own. We author it, so let this be the room where we stop asking permission to thrive, you all. Enough is enough. And I'm not going to ask you to agree with me around that, but I am an eldest daughter, so, read between the lines. I am going to ask you, though, to commit. Every person in this room, before you leave, I want you to leave holding something different. Maybe it's a brave idea for the patient who feels invisible. Maybe it is a radical policy that remembers innovation requires imagination. In Minnesota, we love to say we haven't done that before. Perhaps it's a bold promise to a young person you refuse to let fall through the cracks. But perhaps it is a story, a memory that will protect us, that can be passed forward. And then I'm going to ask for one more thing. Abundance, right? Do not let tonight be the last night that you are in a room with the African American Leadership Forum. Please, come back. Won't you come back? Won't you come sit at our table? Come to some design sessions. Come to the events that the DRALA alums are doing. Come testify when we are at the Hill, pushing policy to make our futures better and brighter and more whole. We did not build the forum to be admired. We built it for you to join us in this work. So please come back. There are real doors here, and they are open. And remember that our ancestors planted us so that we could plant forward. And tonight, we do not just talk about the future of Black health. We continue building it together on purpose. The names that you carried into this room carried us first. Ada and Irene carried me here, and every ancestor named tonight has carried us into this room on this night for a reason. Welcome home, y'all. Our future as well. And without further ado, it is my joy to bring up someone who has stood inside this work with us from the start, Mr. Bukata Hayes, the Chief Community Health Officer at Blue Cross and Blue Shield of Minnesota, is going to introduce our two amazing Black queens and our visionaries and carry us the rest of the way tonight. Thank you, Bukata.
All right, good evening. So yeah, Bukata Hayes, Chief Community Health Officer. I'll move over a little bit. I think that I'll be really quick because we got more important people to hear from. But as you talked about those ancestors, so my father, a pro-Black civil rights activist, as him and his compadres, his sort of soldiers were planning for how they would do their work, one of the things that they challenged each other around was a really simple, really question or encouragement or statement. Like, what are we building, right? So as we talk about the futures, well, what are we building? And they would ask each other, or simply say to each other, what cannot be defended is useless to develop. What cannot be defended is useless to develop. And what that was, it may sound harsh, but really it was this encouragement to be thorough. Policy, system, structure, people, leadership, really redundancy, because it will come under attack. when we build it for us. It will come under scrutiny, and are we able to defend it so that it lasts? What they knew and what we've all experienced is that systems of white supremacy and exclusion have survived for a long time. And if we are building systems that will last longer than those, how are we planning for all of the ways in which we know it will be attacked so that we can defend it? So that's what I would encourage us as we listen to Dr. Sederstrom and Dr. Blackstock, as we think about what we build. Are we making sure we are also including in that how we will ensure its defense on our behalf? So with that, I would simply like to bring up Dr. Nneka Sederstrom.
Everybody laughing at me with my K-pop song as my walkout song. Those who know me know that I think I was Korean in a past life. So, thank you all for being here, and thank you, Dara, for those beautiful remarks. And I know every time you call me to Harriet Tubman, it does something to me. I have pride and I have immense stress at the same time. And thank you, Bukata, for those wonderful words. So good evening, everyone. Welcome. I'm going to move this down a little bit. Turn it this way. Okay. I have a few words before we bring up Dr. Blackstock. So I just want to take a moment and name a couple of things here with you. As we gather here today in this beautiful space, thank you, Jasmine, for this fantastic space. We're all carrying different kinds of power with us. There's community truth, institutional responsibility, policy levers, clinical knowledge, philanthropy, lived experience, but most importantly, imagination. And tonight matters a lot because Black health in Minnesota can't be reduced to just a data point or another disparity chart or even another report that just sits on some dusty shelf. Black health is about whether our people can truly breathe fully, whether we can age with dignity, our babies can be born safely, our elders can be cared for without feeling forgotten, and whether Black women can stop carrying the burden of everybody else at their own expense, and when Black men can go seek care without feeling shame. It's about whether our families can get in before there's a crisis and feel safe enough, and that it's affordable enough, and that they are close enough and respected enough to actually be cared for. Through the Forum's Afrofuturist in Residence work that I have been so privileged to be a part of, we tried to listen really deeply to community. And what we learned through the Get In, Get Care project, which I have to give a shout out to my other members of the Young American Leadership Forum, Young American Leadership Program at Harvard Business School that came up with this idea. Mike is in the back, he's one of my team members. There were 10 of us from Minnesota. It was a fantastic experience. And when we decided that we should do this, the focus was on ensuring that we paid attention to what is that question of why do Black Minnesotans have a hard time getting in and getting care? And what we found is that it's not because Black Minnesotans are avoiding care. It's not because they don't value health. They're making rational decisions inside a system that too often feels too costly, confusing, culturally unsafe, emotionally exhausting, and impossible to deal with. So tonight is not just about naming what is broken. It's about asking how do we bring forward the things that are necessary to stop treating Black health inequities as an inevitability and start treating them as a design failure and then redesign that system. The Forum's role at this moment is super powerful, y'all. You have to be on this wave. We're not simply just convening people for a nice talk about health equity. This is a movement, and it's a movement with community that we are strengthening to try and bring truth into strategy, strategy into accountability, accountability into systems that can change people's lives completely. This is the spirit that we're taking on this work, to ensure that we diagnose the system, not the people, name who benefits and who bears the burdens and what must change, move from a deficit mindset to dignity, from extraction to reciprocity, from listening to action, and from imagining a future to building the conditions to make that possible. And that's why I'm super excited to have this conversation with my friend, Dr. Uché Blackstock. Her work has helped this country, the country, not just a couple people, the country, see that health equity is not a side project. It's not a quick diversity initiative or something you just do when the real healthcare work is doing over here and we're nice enough to have it. That's not what she's done. Health equity is the work of deciding who lives, whose lives are fully protected, whose pain is believed, whose expertise is honored, and whose future we're willing to fight for. And she has taught us the importance of that. So tonight, I invite all of you into this conversation because we're sitting at a kitchen table. That is the concept of this. We're all family. And you know, in a Black household, the important things, the conversations, the important ones happen at the kitchen table. And grandmama says, sit down at the table. You sat down at the table, right? So this is the table. And we're using this conversation not to just sit up here and talk about how great we are and how fancy we are. No, this is about truth-telling and listening with responsibility and leaving, most importantly, with something to do and be willing to do. Because the future is not something that we think about. It's happening now, and we have to shape those decisions today. And my hope is that everyone here leaves asking not only, what did I learn, but what can I now be responsible for to build? So welcome to this table talk, y'all. And we will begin. And I am going to take this time to welcome Dr. Uché Blackstock to the table. It's my distinct honor to have her here. Dr. Blackstock is a physician, health equity advocate, best-selling author, and everybody must get the book. It's in the bag there. She's going to sign it, so please do that. And founder and CEO of Advancing Health Equity, which is a strategic consulting firm where she works with organizations to move beyond performative commitments and toward real accountability, trust, and system change. She graduated from Harvard College and then went on to Harvard Medical School, and she practiced as an emergency physician for almost 2 decades. Her work is deeply personal, shaped by her late mother, Dr. Gail Gloria Blackstock, and by the historic legacy that they share as the first Black mother-daughter graduates from Harvard Medical School. That's that Black girl magic right there. Her New York Times best-selling book, Legacy, which you see here, and again, please make sure you go get, A Black Physician's Reckons with Racism in Medicine, published in 2024, is both a memoir and a call to action, asking us to confront the history of medicine while imagining a more just future for Black communities in this country. So tonight, we are super grateful to be in this conversation with someone who brings truth, clarity, courage, and deep care to this work. So please join me in welcoming Dr. Uché Blackstock.
Thank you, Dr. Nneka. Thank you, Dara. Thank you, everyone, for having me. And just one thing, because we're going to be talking for an hour, I want to make sure people ate, or if you haven't eaten, that you go get a plate.
Go eat, for real.
Please
yes.
do.
Yes.
Okay. All right.
Yes. Thank you. Yes, again, this is a kitchen table, so don't be completely formal. We will have Q&A at the end, so if there's something that pops up, please write it down if you need to, and we will get to that. So first, welcome to Minnesota.
Thank you. It's my first time.
Yes.
It's my first time in Minneapolis,
How
too.
did you spend your day?
Oh, okay. So this morning I had to go pay respect to Mr. George Floyd. So I did go to George Floyd Square. Yes. Yeah, it was. And, you know, I just want to share, I founded my organization, Advancing Health Equity, in March of 2019, not expecting what 2020 would bring, the pandemic-wise or the killing of Black Americans by police. And when he was murdered, we talked about this last night, like literally the request for the health equity work just shot up. And I was so overwhelmed, as you know.
Yes.
But he has guided and so much of the work that I do, and he's always with me.
Yes. She was laughing because we met because I called her to try to get her to come to Minnesota to do an evaluation at Hennepin when I was at Hennepin. And she was too busy to be able to come.
No, I said I'm at capacity, and at that point, I didn't have like a full team. It was just me. I was so overwhelmed.
Yes.
Right. Well, then that's the other thing we talked about last night, right? The fact that it's like there was all this demand for the work, and but there had not been an investment in the work beforehand,
That's
right?
That's right.
So, so it was just me. But I said, I know another set of Black women.
She did, and we got it
Yes,
done, and it was fantastic.
yes.
But I was just like, you didn't like me enough to come hang. It's all right. It's all right, though. We still love you. So let's talk about so then the world went crazy. Everybody was throwing money at all things health equity. You got overwhelmed in capacity, but it was all in a good way until.
Yeah, no, and also I want to say that, I want to just talk a little bit about my journey because I had just left my job in academic medicine. I was in academic medicine for 10 years, and I think I was telling Dara last night, I was telling you that, I was at probably one of the most prestigious universities in New York City. At that time, because my mother had also done academic medicine, I thought that was like the pinnacle, right? And I have to say, even though from the outside I looked like the object of success, I had multiple titles and roles that I never felt so undervalued, underappreciated, and invisible before. And part of it was because in 2017, I'd been assigned a role in our Office of Diversity Affairs, in a lead DEI role, and come to find out it was just a figurehead role. And I was so deeply demoralized by that. Everything that I suggested was knocked down. And so I had to make this really big decision. Like, I think I want to leave academic medicine because, one, I know that it was not created with me in mind. It was actually created to exclude me, and I'm at this point in my life where I feel like I'm in a box and I can't breathe. And so I left this job. People, if you know academic medicine, people don't leave because it's security, right? But I left in December of 2019, and I said, I'm going to focus on building advancing health equity, and I'll work part-time in urgent care. And then March hits, and I'm working in Brooklyn, New York. We're the epicenter, and literally within 24 hours, people are just flooding the urgent care because they're too scared to go to the ER. And I'm seeing patients with oxygen saturations of 60% walking in.
Wow.
And so that was mid-March. By the next week, I had already written an op-ed on how I thought this virus was just going to disproportionately impact our communities, just based on what I was seeing before we had the data, because of all of the risk factors of racism that put us at risk, right?
Yeah.
And so I left, and one op-ed became another op-ed, and then I became a medical contributor for MSNBC, and it was a really eye-opening moment for me and a learning experience for me because it was the way for me to speak to our community. I wasn't talking to the host.
Right.
I was like, how do I share information to keep our communities safe? And for the first time, I wasn't being silenced and muzzled.
That's right.
Right? And so, and then the book came and everything. We'll talk about that. But I'm just saying that, when I say I was at capacity,
I forgive you. It's
like,
fun.
there were sometimes I was on air 5 times a day, and I also recognized that it was the first time many people had seen a Black physician on TV.
That's right.
Because I had people in my neighborhood stop me and say, oh, Dr. Blackstock, I saw you on air, and I'm doing this because you said to do it. And when the vaccine came out, they said, Dr. Blackstock, I'm getting the vaccine because you talked about why the reasons why I should get it. and you said you vaccinated your children.
Yeah.
And I listened to you. And I don't take that lightly.
No. And that's why we talk so much about the importance of having racial concordance in our physicians, because there is safety in knowing that you understand what I'm going through and you see me and I can be honest with you. And when I hear you say, do this thing, I will do that thing, right?
Yes.
Like,
But then I also saw in your report,
yes.
that it wasn't just necessarily about racial concordance is important, and I know, and then there's some studies we can talk about, but it was also values alignment.
Yes, values
Right?
alignment, 100%. Yep, it's values alignment. 'Cause
Right,
we're
yes.
from the same community. We see the same
Right.
things. We understand the same things.
Right.
I don't have to explain to you what my day was like walking into this clinic. You
Yeah.
know, because when you walk in, they don't see your badge either.
Oh yeah, we can talk about, how people think that you're everything but the doctor, even
Everything
though
but the
you introduce
doctor.
yourself as a doctor.
Yeah.
Yeah.
Even then, they're like, are you sure? It's like, can I get the other doctor?
Yeah, the resident or the medical student.
They're the
Yeah, I'm like, okay, that person does not have a license, but okay, go ahead.
Sure.
If you want them to take care of you,
Sure.
go ahead.
And how have you been feeling, though?
Now,
Because we all know what happened with the election. We all know the side effects and all things racism, DEI, equity, all
Yes.
those words became bad. We know the money got pulled real fast,
and we know the bar was so low.
and the bar was already low. Already low.
So what I'll say, I say this, that the statistic that came out last year, they said like 600,000 Black women had lost their jobs. Well,
more now,
because
yeah.
I'm self-employed, I didn't lose my job, but I had to fight to save my business.
Yep.
And like I was saying, in 2020, 2021, I had never been like I had to turn away business, right? But over the years, I built my team. I had full-time employees. Last year sent us for a loop.
Yeah, I bet.
And we had academic institutions that canceled their contracts. We had just, the business just dried up. And I had to actually reevaluate what was the impact that I wanted advancing health equity to make. And I realized it wasn't about like the number of organizations we worked with. It was really about the organizations that wanted to do the work and still came to us, despite what's happening. And they are there. And then I just had to think about, okay, the budgets are different. Some of the priorities look a little bit different. And the other piece that I saw is that some organizations, while they are keeping health equity, and actually they are embedding it more into the organization. So it's not as siloed. Maybe doing it because they don't want it to be as recognizable from the outside, but I feel like that should have always been the case. Health equity should have never been something siloed and distinct. It should have always been something, because the thing is that the other piece is that when we talk about health equity is about quality care. Health equity is about accountability. It's about trust, right? It is about the values that should always be the foundation of how a health-related organization operates. So why now would that be any different,
Exactly.
right? And then also the fact is that don't you want your patients to have the best outcomes possible?
One would think,
Doesn't that
right?
speak
One would think.
highly of your organization? Wouldn't you want that? I mean, just on based on your morals and ethics, right? But then the fact is that there is people, and I hate to say this, there is a business case for it. Like, there's so much money that you could save from making sure that people are well cared for.
Yep. There is money in keeping us sick.
There's what?
Money in keeping us sick. More money in keeping us sick than well. So much of your work talks about truth-telling and racism in healthcare and not losing sight of the people who are harmed by it. So I gave you all the data of our Get In, Get Care stuff. Yes, people will have access to this report. So when you saw that, like, Black Minnesotans, they shared in this focus groups that there were serious feelings of fear, dismissal, shame, exhaustion, distrust, but still a deep desire to be well. What rises up for you first? Like, what do you think healthcare leaders should know from just the feeling of Black Minnesotans that they want to be well, but there's all this other stuff? What do you think is the...
No, I mean, okay, so I'm going to go back to the very beginning of my life. Growing up in Brooklyn with my parents, but what I was able to see when I was a young child is my mother and other Black doctors in the community thinking about what does holistic care look like for community members, that we know it's not just what happens inside the clinic room, that we know it's about making sure that, so when people would come in to see my mom, they knew they weren't just coming in to be asked about how are you physically feeling, or this is what your blood work showed.
It's the whole person.
Yeah, she was going to ask about their family members. She was going to ask about what was going on at work, right? And so I believe that she was practicing what we call structurally competent care in the 80s and 90s, where you're thinking about what is happening in my patients' communities, and where they work, where they live, where they love, where they pray, what is going on, because we know that impacts their health as well. And so I'm just saying, these ideas, and I even think about the Black Panthers in the 60s who were practicing holistic care, right? They weren't just, they were providing free clinic services, but they were also providing transportation for people to visit their loved ones who were incarcerated. They were doing sickle cell testing, free breakfast giveaways, right? And so I think that this idea of having a holistic view of what health is, that it's not just about, and I had to think about this process, because we are trained in the Western biomedical model. The schools that we go to, there's sort of one way that they think about becoming a doctor, right? And you learn, about in pharmacotherapy, this is pharmacology rather. This is the medication you take to do this, and don't drink a lot of alcohol. But the fact is that we know more than 80% of what impacts how healthy someone is are systemic factors, right? And so our patients, they know that. It's really time for the systems that care for them, beyond time, for them to recognize, how do we truly care for people, right?
Yeah.
What happens in the exam room is just one part of it, right? But I think the investment in communities, we actually would have an even larger impact on improving health.
And I think that's one of those things that we pay attention to a lot in Minnesota. So I'm going to give a little bit of data for you all. Our data shows that Black Minnesotans are not avoiding care because they don't value, and that as percentage of them, the exact percentage is 30.7% of Black Minnesotans went without care due to cost in 2023, and Black uninsured Minnesotans rose from 6.3% to 10.1% because of the new bill that just passed. We also know that there is an excessive amount of what we call cardiometabolic risk factors, right? So diabetes, hypertension, chronic kidney disease, heart failure among Black Minnesotans. So the community stories, we know that we've got the medical data to show that we have this, but what the Get In, Get Care data showed is that we have people who are experiencing excess stress, food insecurity, caregiving concerns, and delaying care due to risk. And we know Minnesotan is special when it comes to that. We just dealt with the operation where ICE was in our communities, increasing stress, fear, and risk. So we sit in a very special place here. There's not a lot of us in this state. It's just not. And we have some of the best healthcare in the country in this state. Mayo Clinic, y'all. Anybody heard of that little place, right? And yet, we have significantly problematic outcomes for our Black community. So if we think about it from this big holistic view, what do you think Minnesotans can do to lead differently in this space?
So Actually, when I was going through the questions, I actually wanted to hear from the audience because I know that there are a lot of folks in here that are doing really important work, and I know that the solutions are always in our community. So I am actually curious to hear from some folks in the room about what we can do.
Yes, and
And we have
the mics are
a
coming.
mic over here.
Yeah. The mics are coming.
So just raise your hand.
Oh, there's one now.
Okay.
Oh, right there, and
So
then
if
there's
here
one down front.
and then here. Yes, thank you. And then here.
Oh, hold on. The mic is right there.
Right here. Right here. Yes, everyone has
We
to
need to hear you. Yes.
And could you stand up and just say who you are? Okay, thank you.
My name's Rebecca.
Hi.
Rebecca, and I would prefer to see more introductions to holistic medicine in our area. I don't think there's enough here in this area of Minnesota, Minneapolis, and the healthcare facilities that we have currently. Bring us in, bring us out. Bring us in, bring us out. I kind of feel like we're like cattle. You know what I mean? And we go to the doctor. We try to stay healthy by attending to the things that they say we have. You know, and if we take ownership of it, then we go try to get help. But it doesn't work as effectively as it should. So I'm ready to take a more holistic approach in my life to make myself be a little bit more healthier.
And Ms. Rebecca, can you say, are there certain strategies or things that you've seen that may be helpful specifically?
Well, as a person dealing with diabetes, high blood pressure, and heart issues, you rotate these doctors on a consistent basis. And you have your highs, you have your lows. And when you have your lows, then you really start getting the attention of what you need to do about it. And the first thing, it seems like the doctors just want to put you on medicine. They want to offer you this, offer you that, take you off of that, change that to something else. And it's just like a vicious cycle that you just keep circling. And I think more of a holistic approach would be more pleasing to me, and I'm sure other people would probably like to seek that out for themselves as well.
Sure. Thank you so much for sharing that.
I know we have the
And I also just want to say that we know that our public health infrastructure, just overall in this country, has not been invested in significantly, right? And so when I think about health, the ideal would be that we want to is prevention, right? Not illness. Right, and so unfortunately,
there's no money in prevention.
I was about to say, because we're a for-profit healthcare system, that's sort of one of the focus. But it really should be on value-based care, how we can make sure that people don't get sick. Like, you should be rewarded for that if you're a healthcare system. Okay. Oh, I'm just gonna have.
There's one in the
back there. Yes.
And then I have a few over on that side. Yes.
Hi. I just wanted to first express gratitude and just real appreciation for the event and you sharing another opportunity to share the information that came from the survey and focus groups. And the strategies needed to address, I believe, en masse, the experience of African Americans, not just African Americans, and that's where I think our first oversight happens. That we are not a monolith. And in those numbers, there is so much nuance and so much detail that there are Black identities. And when and each strategy for bringing people into healthcare have to recognize the differences that exist within community. For example, if you are an immigrant to this country, we have large numbers of Liberian and Somali residents here. That requires a whole nother strategy in our Black identities. If you are queer, that requires another queer across all the letters. That requires a different strategy. I happen to work a good deal with homeless African American men. And that requires a different strategy. If you don't have a steady place to sleep and you're dealing with drug addiction, that requires a different strategy. And so many times we are not drilling down into our Black identities that are required to really make a public health, large, en masse transition to bring wellness to the people. And so that's the first thing. In order to do that, I really believe strongly that we need more sophisticated IT solutions that help us be able to manage and track people's experience over time. Right now, if you attend this event, there's no way to there's no way to follow up. There's no way to figure out, did you attend this event by the African American Leadership Forum en masse, collectively? Is this your third event? And when I say that, there are experiences often across the community, and we don't have a way to, wellness isn't a one-time event. It's something that happens over a period of time, and we don't have IT strategies that allow us to track people over time. So I'm gonna cut it off.
You're okay.
But how do we use our IT and how do we speak to the nuance of all our identities? That's it. And those are, I believe, our solutions are found there.
Okay,
Thank
I'm going
you.
to let Dr. Nneka respond.
Yes, so I agree that there is a significant struggle in pulling the identities, right? Because we get boxed in, we get othered. There is a foundation of whiteness being the standard, and then everything else is other. And it all gets boxed into either you're people of color, and so we all are there, or you're BIPOC, so we're all there, right? We get all these various things where we're supposedly collected together without the ability and the respect that you're talking about of requiring each identity to have its own space. And that is a significant issue. And I think that when we futurize and think and imagine how we can be better, the first thing that we have as a shared commonality is race. Then we have the intersections of all of our other identities. So if we can work from race first as a uniter, because when I walk in the room, I am Black first. You don't know anything else about me except being Black, right? That right there is a unifier. When we can get past that, then we will have the ability to focus on what it means to be a Black woman, or a Black woman in her 40s, Black woman in her 40s perimenopausal, right? Then you grow and grow and grow, and then you can start seeing me for my whole self. But we haven't gotten past this initial, she's Black. We're still there. And so the dream is to get past that so we can see a complete person and understand what they need and be really intentional about providing them with the care structures that are necessary to address their particular health initiatives and their health needs. So I 100% agree. That is a strategy and a direction that we have to go to. I also really want to talk about, really quickly, the use of AI and technology. And I'm going to say this because this was a quote from the focus group, and I think it sums it up. I asked whether or not the people in the focus group who were Black women of varying ages, would they be willing to use an AI-related care thing, right? Like some sort of pod in the community that provides access or something that AI is driving. So, we're never gonna have enough Black and brown clinicians to cover all of us, but maybe we can do something AI-based to help. And this wonderful elder said to me with a straight face, if in this AI pod, my doctor looked like Idris Elba, I would get in and get care every single day. That's what she said. That's what she said. She said it clear as day. She was like, he will know about everything going wrong with me, and I will listen to anything he has to say. So maybe there is something about better AI infrastructure that we should probably be figuring out. And I don't know whether I can get Idris's people on the phone, but I think she's got something going there.
He has a foundation.
He does have a foundation, that's right. But there is something about like using technology to our benefit. So I agree, there needs to be better, more thoughtful, innovative strategies of how we use technology to address the needs. And if it's an Idris Elba avatar, the forum, Bukata, y'all may need to come up with some money to help the forum figure out how to build that, because I would get in and get care too.
Okay,
Yes.
I do want to add just a few things while we're on AI. So there's one study that came out recently showed actually that Black older adults actually use AI a lot
They do.
for health information. And so, you know, when I think about it, I don't want to think about it as like from a judgmental perspective, because people are trying to fill a gap.
Yeah.
They're trying to fill a gap in terms of access, right? Of you know whether they have a clinician or they don't, or they have to wait 6 months to see somebody. They want to get the information quickly. Understandably, they are worried. And then also the other piece is, and this is more social media influencers, is that people find people online that they feel like they can relate to or may have gone through a similar illness or experience in them. And so they get a lot of information from that person. And so I think what we have to do is really think about how do we direct people just to make sure that they're using the right resources. And then also there needs to be, as you know, accountability for whatever AI models are being used. Like, where are they getting the data sets from, right? Are they, have they evaluated in different populations? So all that is still very important.
Yes,
but I just
all
want to
that.
say that, just make sure that we say that we actually are using it disproportionately compared to white patients. Yes, and so again, not really taking a paternalistic view on that, but thinking about how we can really support people as they use these other resources.
Yes, and so that brings up a topic about trust, right? The system has always tried to make this case, and I have for years said, I don't know who thought about it this way, so maybe you can help me think this way. Who said that Black people trusted healthcare? Then Tuskegee killed that trust, and now we got to rebuild trust. Who said that? Because that is the impetus for all.
Yes.
Oh, you know, we Black people don't trust the healthcare because of Tuskegee, and so we have to rebuild trust. And I'm like, how many people even remember what Tuskegee was, let alone it being a thing for why Black people today don't trust healthcare? But that has been this constant conversation. It was that one event. Forget the fact that the system was never built for us.
Right.
But that one event is somehow why. And so these systems that are rebuilding trust, their premise is off.
Right. No, I completely agree, and actually that's why I wrote Legacy, because I wanted to talk about the history, and the history didn't start at Tuskegee. But I also I wrote a piece last week for MS Now, because, and I'm sorry, don't worry, we're gonna come back to you.
Yes.
Because two things happened. I don't know if people saw, there's a lawsuit that several Black families are filing against the federal government, because in the 1960s, there was an RSV vaccine trial that their babies were enrolled in, and they were not given, they didn't realize that it was a trial. They didn't give informed consent, and 2 of the babies died at around less than 2 years old. And so the only reason they found out is because there was an investigative reporting by a publication 3 years ago, where they found the names of the children in the book from the doctor at NIH. And they reached out to the families, and the families found out, obviously devastated, and so now they're suing the government. And so thinking about that, right, that happened in the 60s, but these families are only finding out about that now, right? And what does that do with trust? And then, I don't know if people also heard, I'm connecting this, Find a Black Doctor, the online directory, is being sued by this horrible group called Do No Harm.
Oh, those are the ones who just talked to me.
Yeah, me too. They tag me all the time too. And to say that that it's racist, illegal because there was a white doctor that tried to join and they couldn't join. Find a Black doctor. It was founded by a Black dermatologist. Less than 2% of dermatologists are Black. But it's for all different types of doctors. It's for Black folks to go online to find a Black doctor. And like you were talking about, I can't remember who it was, but it's like when a Black patient goes in to see someone, it's a calculation they're making. They're trying to say, are you going to harm me or not? Right? Like what are you about? Right? And so the Find a Black Doctor directory is like a response to that, right? And I think that plus the lawsuit coming out, right, and you talk about trust. So I say this expression that is often used of medical mistrust, I hate that expression because it places the burden on Black patients. And I prefer the term institutional untrustworthiness because institutions have not proven themselves trustworthy for centuries. So like you said, it's not about rebuilding trust. It's really about building trust, right? And how we do that, right? We center communities, we power share, we have accountability, right? All of that is very important. I'm sorry. Okay. Yes, you had a question. You can have my microphone.
Oh, you can just speak loudly too, if you're okay.
There may be people. No. There may be people in the room who can't hear.
Oh, thank you. My name is Dr. Destiny Woodruff. Folks call me Doc. Folks call me Destiny. I'm also a proud auntie. I wear both proudly. I'm also perimenopausal, so when you said that, it spoke to me.
Yes.
Just want to put all that out there.
Yes.
Thank you for all those who are also perimenopausal and doing their best to hang on and keep their nerves in check.
Amen.
Thank you for those who love us. Where was I going? Okay.
It's okay.
All right.
It's okay.
So with this, I will say thank you both for being here. Thank you everybody for being here. But one of the questions you asked was, what can Minnesotans do? So it's my 4th year being here, but one thing I've noticed as a transplant is that when I see Black people out in the community, I'm going to speak.
Right.
Now, I'm not originally from here. And normally when people hear my voice, they can hear it. And they're just like, oh, now where are you from? I said, oh, that's so sweet. Well, you know I'm not from here.
Right.
You know, where I'm from, we speak. We say hello. So before we get into, the stats that, Black women or Black birthing folks are 3.5 to 4 more times to die in childbirth, it's, have you said hey to your neighbor today?
That's right.
And because I was able to say hey to my neighbors, and I was living in Iowa, and that's pretty white too, I said, hey, Joyce. Joyce worked with me in the building. And I said, hey, Joyce, I'm having a hard time finding a doctor. She said, listen, I have a doctor. You can go to her because I vetted her.
Yeah.
I interviewed her. So I feel safe enough to tell you as my sister, go to this person. I've already vetted her. Me and her have already had to come to Jesus. She's good. I said, wow. So I would say some advice is, one, get to know your neighbors. Be able to have community conversations that challenge that we won't be able to find health care. And 3, have the courage to go. And if you don't have the courage to go, have somebody that's really strong in your life to kind of push you to go there. Once you find a doctor that is safe enough. But the sound advice I would say is interview the dang doctor.
And
Ask
if
those
any
questions.
doctor has a problem with being interviewed, then that's the
Absolutely.
That's a problem.
That's how you feel. Yeah.
So I tell them, I
feel
said,
the
I'm
same
Black
way.
and I'm gay at the same time. You need to treat me at the same time.
Yes. Yes.
I'm black as hell, and I'm gay as hell at the same time.
At the same time.
Same
At
time.
the same time.
So I'm not
That's
prioritizing one identity over the other, but when you see me, I will say, I'm proudly Black and I'm auntie.
right. Yeah.
But you had to treat me both. You got to treat both of me, all of me at the same time.
And one of the things, thank you for that, for sure. Thank you. Another data point that came out of the survey was to get at this concept of like the fear of going into the system, right? It was brought up that, especially for Black women, it is too challenging to add on to already challenging lives the addition of navigating a system that we already know doesn't even want us there. So we would rather wait till the very last second to go in than to add on to already stressed out, super burdened lives, the addition of taking care of ourselves, because we're taking care of everybody else and ensuring everybody else is good. And we know that the system is going to add additional stress to us. So just walking into the door, even wanting to pick up the phone and make the appointment, is a burden that we just don't even have time for. And we have a lot of work to do with that. And we talked a lot about earlier about the maternal health problem. And it's not just around women who are birthing. It is the whole spectrum of women and care of the full woman, a Black woman, and how the impact of the stress impacts our babies, as we know, for those of us who birth babies. But the impact of the stress impacts us, period, because we know when Black women have the highest level of heart disease, right? How do we help the world understand that we can't carry it for everybody all the time? And we, too, need somehow space to be made where we feel safe enough to pick up that phone call and make the appointment to maintain us, because when we crumble, the whole culture crumbles. There you go. Did it turn on? Here, you can take mine.
Sarah, did we talk about this last night? At dinner. Well, one, I'm just glad we're having conversations about this, because I feel like other generations, and I'm not accusing anyone of anything, but in terms of the modeling that we got, is like you just go, and you take, yes. And honestly, I think about my mom. One thing that I didn't share, as people that already know, is that my mother passed away when my twin sister and I were 19 years old, and she was only 47. I'm 48 now, and I have to tell you that when I turned 47, I cried, because I didn't think that I was going to last till 47. And my mother actually, so when I was 19 and she died, I was only 19, so I was like, that's my mom. She's an amazing mother, and I knew all the things that she did, and she took us to all her meetings, all her conferences. But I don't think I understood, as I did at like 47 and now 48, everything that she was juggling and holding, being the first person in her family to finish college, being the first person in her family to go to medical school, then coming back and practicing and trying to find mentors and reaching whatever you call it, that ceiling in academic medicine, where then she had to leave her career, right? And then having twin daughters and putting her all into us, right? And then being there for her family. I didn't know all of that, and so she was diagnosed with acute myelogenous leukemia at 46, and I think about the kind of leukemia that she had is something that's very rare for a young Black woman to develop. It is most commonly older white men. And I think about what was it in her life, because she was born on public assistance, raised in poverty, always moving, food and housing insecurity. And I always wonder what all of that did to her body, right? And how that contributed. We know about weathering. Arlene Geronimus from University of Michigan has written extensively about the weathering, how that chronic stress causes a wear and tear of our bodies, early premature aging. So I think about all of that, and I think about how my mom, she deserved to be able to see us graduate from college, and from both of us from Harvard Medical School. She deserved to be there and to be there today. And I think about just all the stress. And that's why I'm glad that we're having this conversation, because I think putting ourselves first has always been somehow controversial, but how can we continue to do this work, right? This work that is purpose-driven and so important for our communities if we don't take care of ourselves first.
Adrian, I know you've had your hand up, but I don't know where a mic is. Thank you. Go ahead. It's not working? Oh, there you go. Yes.
Good evening.
Good evening.
I'm Katie Como. I'd like to say thank you, deep gratitude for the work you do. Many would perish without your presence, so deepest gratitude for showing up. My question is, let's talk about money. Hundreds of thousands of Americans are about to lose their health insurance. How are we going to help our communities? How are we going to serve them with our specialized modalities, our resources, our office hours? There's going to be people that can't afford to come see us or pay us to do our work. What resources are we creating for free or accessible to make sure that we stay alive, that we stay empowered, enlightened, and cared for? We are all we have, and it's evident that this country is okay with us dying. So let's talk about how we're going to stay alive here.
Woo, child, yes. Let's talk about it. No, I agree. Because I give a lecture often on the history of racism in medicine, and I often bring up Dr. Rebecca Crumford, who was the first Black woman physician to graduate from the New England Medical School in way back, it was like early 1900s. And she's famous for, she wrote 2 books. And their books were teaching Black community how to care for Black community. Because there was no healthcare system that was available to newly freed Black Americans. And I talk about her because I say that she's sort of that moment in time when the Black community learned for us, by us. Like, if we want to live in this country, we are going to have to take care of ourselves. We cannot rely on the system to care for us. So we do have to step up. And I think that you've brought up a very important question, because it's more than just the imagination of what we can do. It is the resources to make that imagination real. And we still are significantly less when it comes to resource distribution and access to resources in this country. But we are not diminished when it comes to innovation, strategy, and capability, because we have always risen out of nothing. We've never had abundance, right? Could you imagine what we would do if we had abundance?
But just not the capital. Yeah.
Right. Yeah. We've never had the capital to be able to build the structures the same way, but we have still survived. So in thinking about that, because that actually moves into what I was going to pull up next, is as we're thinking about this futurism of how we can be better, knowing that we're going to have to build this ourselves. And as Bukata said earlier this evening, we're going to have to build it in a way that we can defend it and make sure it lasts. What do you think we should start doing? What should be that next step?
Someone has
the
their
redesign?
Sorry, do you have a response?
You have a response to that redesign?
Yes, and while the mic is getting to you, I'll just say, this is why I always mention the Black Panthers and before that, because no, literally, we don't have to reinvent the wheel. We have models already, and I also am a big proponent of mutual aid. I mean, it has gotten our communities through the most difficult times, so we have folks who know. We, within institutions, need to listen to them.
Yeah.
I'm sorry. Okay.
Dr. LaVon Moore, Chocolate Milk Club, midwife and lactation consultant. And one of the things we talk about cost, we talk about, first go back to the beginning. And good health starts with breastfeeding.
Yes, it does.
So we need to reclaim the cultural practice. We're attempting with Chocolate Milk Club to reclaim the cultural norm of breastfeeding in our community, because that's where good health starts, at that prenatal point. How we're treating our bodies as those babies are developing within, and how we feed our bodies. We know that the benefits, right, of breast milk is not just important to that infant, but it's also protective and a mitigator for the health of the breastfeeding person, and it pays forward to protect future health. So that's one of the things that's free of charge.
Right.
Free of charge.
Right.
And we're probably one of the few mammals giving our babies something else than what it was designed for. So that's one tool that doesn't cost us nothing to go back to. So.
Thank you for that.
Thank you.
Can I just say also, I feel like there are solutions all around us. So, and I wrote about this in my book, The Roots Birthing Center. You all familiar, right? But, founded by a Black midwife with the mission of providing dignified and respectful care to Black birthing people. But they've done studies that have shown that model improves outcomes for both the birthing person and the baby. Yep. So I just feel like we have a lot to learn from. We need to amplify the solutions that are already there.
Yes.
So Dr. Nneka and Dr. Uché, hey, the voice of God in the back. It's Gabby. Hi.
Hi.
Oh, you were up here before.
I was up here.
Here.
Yes.
Okay. Yes.
Okay. So we are officially going to transition into the Q&A. I know we've been bleeding it in.
Sorry, well, we got real excited. No, but thank you. We will, and we will start with
Miss Jackson.
Miss Jackson over here. Yes, thank you.
And I guess it's not a question as much as planting a seed.
Sure. Yes, please
And
plant the seeds.
pushing 80, I'm sure that if I'm not the elder, I'm amongst the
Yes.
elders. So, but one of the things that I would like to encourage us to do is that if you live long enough, you're going to be there. So to start thinking about it now. And I'd like to continue on the monetary piece, because it seems as though we've come up with a lot of strategies, but it still goes back to our capitalistic society. Just yesterday, I ran to get my prescription, one of which was one of my inhalers for my asthma. I was already wheezing. I was having a coughing spell. She gave me the packet. I'm opening it because I need to use the inhaler. And then she said, oh, by the way, the copay is $323 for one inhaler. And so all of what we've talked about, yes, but in the meantime, and for the elders, and I pray every day, God, just keep me as healthy as I am now, because that's how I continue to move. But what do we do in the meantime? And for me, as well-connected as I am, and thank you for acknowledging the elders when we started, the next thing that I know I'm headed to now when I leave here, I'm headed to HCMC because I know I can get a free inhaler at HCMC. And we know how that's been threatened lately as well, so we need to also be thinking about that. And so I just wanted to plant the seed in terms of capitalism, money, and what that means, because aging is not for the faint of heart.
Thank you for that. Adrienne has been desperately waiting. She's right behind you, Gabby, right there.
And then we have over here.
And then I'll just say there are a lot of people who've been desperately waiting.
Sorry.
Yes.
So
Yes.
we are going to
I just see the hands in this direction.
circle around.
apologize.
This woman back here on this table has been waiting, so she is next after Miss Adrienne.
Well, I don't have a question. I was going to respond to what can we do. And first of all, I'm Dr. Adrienne Thornton, recently graduated, yes. And I am the Director of Health Equity at Children's Minnesota, so I am living this every day. And I first want to say for the disaggregation of the data is coming. CDC has put things in place to break the data out. So when you say you're Black, African American, are you African, are you Somalian, are you Ethiopian, it's coming. It's not here yet, but we are literally fighting every day for that, so it's coming. But one thing that I fight for, and if you know me, if anybody here knows me, you know I talk about this every day, we need to do more mobile health.
Yes.
I was the manager of a mobile health clinic. It was minimally sourced but moderately successful. There are tons of studies out there that show that we can improve health disparities, provide better care with mobile health care. I've talked to Dr. Brooke Cunningham, our state medical director. I've talked to Governor Walz, and I'm like, hey, if you got some money, could we have some for mobile health? And so I'm going to keep having those conversations, Bukata, so that we can get some support for it and some money, because, you know, people, if you bring it, they will come. And we surveyed people at a community health event in North Minneapolis, and we said, hey, you know, if we bring a mobile clinic to North Minneapolis, will you come? And they were like, yes. Heck yes, I'd rather come here than to come to your hospital because I don't really trust y'all at the hospital. And so I would love to see more investment in that, you know, everywhere, but definitely statewide. I think it would make a huge difference in the health care of the state.
Thank you.
Thank you. Who was the
Okay, I'm
person on-
going back to the middle table
Okay,
because
I was like,
And then there's
she's
some up
been
front
waiting.
here.
and then we got up front.
Hi, I'm Ronell Robinson. I'm with Way to Grow. We're a home visiting program, but we work with foundations, with the health plans, with Blue Cross Blue Shield, with Medica, with health partners. And I sit on so many collaboratives. The Birth Equity Collaborative, the Birth Justice, I'm not active on, African American Babies Coalition. You've got collections of doulas here, but some people are overlapping in different parts and some people are doing their own thing. And so Minnesota is so fragmented in the community. And it's hard for one entity to say, can we? And so this is beautiful tonight to have a collective all looking at health, but we're still looking at it from different points. Since there's all these different spokes, there's a center and there's all these spokes. So I know with one of our groups, I'm part of the Minnesota Coalition of Family Home Visiting, and they brought Dr. Bonago to do trainings here on hypertension. Now, hypertension affects our pregnant women, it affects all the way up to the elders. But the systems of, like you said, stress, of how to decrease stress, how to do more gardening, get out in nature, how to do more breathing activities. Some people are like, I ain't doing that woo-woo stuff. It's like, it's not woo-woo stuff. It's foundational to be in the earth and growing your own stuff. To breathe, most of us are holding our breath half the time, driving, working. If we have to go into a center and even think about dealing with microaggressions, that's where it starts, is at the front door when you walk in somewhere, is how you're treated as soon as you walk in. So I just hope that there is more foundational funding for community initiatives, the community health. Beck is working on policy, bringing it to the state when possible. Many things get shut down, but the support and funding for doulas to get insurance reimbursement for their work. That got passed a couple years ago. That's still in place. Now there's postpartum doulas. There's dad doulas. So I'm going to stop now because I know other people want to talk. But trainings, just even on the foundations of hypertension, getting all of us to look at how can we reduce any levels of stress in our life is impactful.
Yes. And can I just say thank you so much for sharing that. And I wonder if there's an opportunity. I don't want to put any more work on the forum.
I was going to say the same
can
thing.
we, is there a way to get folks together? Okay, thank you. Okay.
I was going to say, I think that was a cue for the forum.
Okay.
Before we transition, was there anything that you guys want to say? Because we're going to formally move into questions that people may have
Gabby
for
keeps
Dr.
saying
Uché.
questions, y'all. Questions.
Okay, it's fine.
Okay.
Yes, there are questions up here.
And there's
Or
a
comments,
back table
questions
back
slash
there,
comments.
and the back table over there where
Thank you.
Geraldine is.
Hi, my name is Jalen Elam. So I am a new mom. My son just turned 1.
Congratulations.
Thank you. And I remember when we were scheduling our first prenatal appointment, and we specifically wanted Dr. Brown. I don't know if you guys know Dr. Brown out of Woodbury, but she was booked out. So there was no way I would be able to get to her in time. And so we ended up scheduling with a white doctor just to be timely. And I remember in my first appointment, one of the first things I said to her with a straight face was like, I'm terrified. Like, how am I going to get, I'm terrified. How am I going to get to the other side of this? Because you hear about, the death rates for Black women in maternal health. And, as a new mom, I'm thinking about all of these things. And she never once denied any of that. And, I went on to have a great experience with her. But I remember after that first appointment, I went to my notes and just kind of looking. And she had verbatim, Jalen said, I am terrified to give birth. And reading that just reminded me of how true that felt for me. And so I'm curious, inside of the sector and the system, of the medical system, what conversations are you guys having with each other that better equips these white doctors to be in space with me, for, to hear me say, I am afraid, and to write that note, but then also what do you do after that? How are they prepared, and what resources have been available to them?
Oh God,
Yeah, I know there is.
And are they?
There's a lot of work that needs to be done, and I don't know if you know what's happening with medical schools now, but there's direct attack on the curriculum, on the what we call like the diversity requirements in the curriculum to talk about issues like this, about structural barriers to care. So this is something that is definitely a hot topic, but this is also why it's not just about what happens inside medical schools. That's very important as well. But doulas, midwives, like we actually need them to come inside of medical schools to give education, because most physicians think that a hospital birth is the standard. That's what I thought. I didn't even know about doulas when I had my first child. I didn't know about midwives. I didn't know that I could have a home birth. I didn't know that a birthing center was an option, right? So, I think of some of the organizations that you mentioned, the collaboratives, like there is so much work that has to be done in terms of educating the community, including me, that I didn't even know, that we're not taught in medical school. So I'm an emergency medicine physician. You know what I would see? I would see the home births that went wrong.
Right.
And then I would hear the OBGYN team come down and disparage the mama and say, what was she thinking? Right? So that's why when I also say in my book, I actually have a call to action at the end. It's also to physicians to really think about the model of medicine that we're trained in, and that it's a very traditional model of medicine, one that is based on experimentation and exploitation of Black bodies. So there is a tremendous amount of work that still needs to be done inside medical education. So that's why, and I know that we talk about, I don't, like, giving birth, that should be a joyful period. You shouldn't have to worry about being scared, but understandably, we know the risks out there. I was scared too.
I was so scared when I gave birth to my second at Children's, Mother Baby in Minneapolis, that when I walked in labor, I told the poor woman at the front desk who has nothing to do with me delivering a baby, I said to her, please don't kill me. And I said that to everybody that I saw in the beginning of my laboring process, to the point where they found the one Black
and we're
nurse.
Physicians.
Right. The one Black nurse that was she was somewhere in Alina, and they found this poor woman and dragged her to my room to be my nurse for the evening, because I told everybody to please not kill me. It is a struggle that we carry that is very challenging to get the others to see. And just like Dr. Blackstock said, we're just not trained to see it, because the system was never taught to see us, right? So I have taught residents in the past, and even attending physicians who got really stressed out when I said this. Like, I'm not telling you that I'm gonna walk in a room and I'm gonna see a white doctor and I'm just be like, you can't take care of me. That's just not true. My OB is white and I love her to death and she's fantastic. And she got what I was asking for, and she understood my need and she owned it, right? It's like, all we're asking is acknowledgement that this is a real thing. Acknowledge that there is fear and concern because you know the data. Acknowledge that the system was not set up for me to have a safe delivery or people around to believe me when I tell about my experiences. Acknowledge it. That little act of saying, I understand you're scared and I know that you're terrified and I'm gonna do everything I can to help you get through this, helps to bring our cortisol down, right? Brings that stress down, helps our bodies feel better, because I can trust you saying, I don't really know how to fix it, but I'm gonna do everything I can to make sure it doesn't happen to you. And we just need to teach them to be better and okay with that. But that, as I was told many a times, was too radical. And it's like, you want me as a white doctor to own that I'm white? I'm like, did we not know you're white? I mean, is that a new thing? I didn't realize that. But there's some fear of even just owning the power differential of that one thing in the room with a Black patient. The ownership of it decreases the stress, and we have to be better at that.
Yeah, and I think just going back to knowing what your options are, that you may not have to have an in-hospital birth.
Right.
You could have, and you can have a midwife at a birthing center, or at home. I think what's really important is for us to know what our options are.
Yep.
I think that is very critical, and I think also we're dealing with the omnibus bill, it came back up. And I don't know if people know, but Black was removed from the bill. It's only mentioned once. And I know we could have a conversation about that, and I know that the representative and senators that are trying to get it pushed through did that for a reason. But the fact is that it still impacts us the most, right? And we have to have some way of acknowledging that.
Who's next on the,
Me.
yes, hi.
Hi. Zaylor, lawyer and historian. So it's actually, this question works perfectly with where the discussion's going. So given the fact that the system was never set up to represent us and include us in their data, whether it be African American or women or the like, I guess my question is, I know that there's work that needs to be done inside the system and work that needs to be done outside the system. And is your take that is there enough work being done outside of the system from our community collectively in regards to collecting our data and doing our own tracking and all that kind of stuff? And if there is, who should we be supporting in regards to that work? And if not, what should we be doing to try to make sure that that's something that's happening?
Looks like Dara wants to answer that.
That's a dare question again. No, so I agree. As she said, there are a lot of community builders out there. There's coalitions upon coalitions upon coalitions. The question is, where is the central think tank putting all the cues out there that helps us to build direction, right? And I think that that's one of the very important points of these Afrofuturist in Residence programs, right, is that we can say things like, we're pulling in policymakers, we've got community, we've got activism, we've got everything in this room saying, we need to tackle this together as Minnesotans. Well, you're all here, so we're all here because the forum convened this here, and that is the purpose of the forum, is to be that think tank machine to say, we Minnesota, Black Minnesota, we have a problem. Let's figure out how to address this problem, and let's bring everybody to the table. Now, the next step is where we have to get to. It's like the next step, because Dara can't fix it. I would love Dara to fix it. She can't fix it. So, so we're here, right? And the call to action is we know that there is a siloing of all of our entities. So maybe our next step is figuring out how to break that down. Maybe the next step is an opportunity to have stakeholders from each one of the various things come together with Dara and talk about what does a unified body look like and how do we build that. So that next iteration of what coalition building is, I think we do need to work on.
Dara, did you want to say something?
I know you had your hand up a bunch. Is there a mic for you? Because you've just kind of been statistically. Oh, sorry.
No problem.
Somebody needs to just be like, Nneka, look this way.
Hi, I'm Ayers. I'm a recent college graduate. Just
Congratulations.
In this last month. Thank you.
Yay. Welcome to adulthood.
And I'm on my path to hopefully becoming a medical anthropologist. But as we sort of discussed, there's a lot of ways in which this administration has both defunded and devalued healthcare, scientific inquiry, and any really sort of sustainable career in health and exploring that in a critical way. Yeah. So as a new grad, and for the people who are just starting off their professional careers, what sort of advice do you have as we both approach research and praxis?
Oh God, I would just say stay in school a little longer and the world will get a little better. It is so hard.
Yeah, I would say this, that I know this is a moment. It's not going to last forever. It's a really difficult moment. I think what's very important, convenings like this, being in community with each other, but looking at maybe other non-traditional institutions that you can do your work with, or organizations that you can do your work with. I think for me, when I thought about the fact that so much federal funding went towards academic institutions, and just several swipes of a pen it could disappear, that's never how it should be. Right, so we have to reimagine how we can develop a system where we still can study this and we can still collect the data and do what we need to do, but without depending on these larger systems.
Yeah, as Dara says to me all the time, it is a season, and seasons change. So it is a valley, but we will rise again. And there are many other ways of doing things. Jobs, internships, global experience, get out of this country, do things elsewhere with people who are being more in line with how you think and see. Medical anthropology is a fantastic field, and there are a lot of opportunities there if you just look outside our borders.
Yeah.
Before we transition,
he had a question for a very, very, very long time.
there are a lot of people in the room with so many questions. And so I want to be.
I feel like you, with
she's,
the baby,
she's next.
she has to ask the question.
She is actually next.
Okay, good. Okay,
but I was going to say, we're going to take about 3 more questions, and then there will be time to talk to Dr. Uché at the meet and greet. I promise everybody in the room. So 3 more questions, and we're going to pass it this way, and then this way, and then this way.
Okay, perfect.
Okay.
Thank you so much for being here. I am honored to be here with my baby. I'm a new mother, and I can share the same sentiment. I was extremely scared, extremely nervous. I was so scared that the whole time I was pregnant, I never seen a doctor. I never seen a doctor because that's how afraid I was. I only seen midwives the whole time I was pregnant, and it's because I didn't want a traditional experience. I wanted everything that I could have possibly had. And I'm like, if I'm gonna do that, that means I'm not with a doctor. My question is, how do we get integrative health as an option for people? I remember when I was a young adult, I'm still young, I had a wonderful doctor. She was in integrative health. She was a Black woman, and she was at the time I was at HCMC. And I think I had her for about 2 years. And afterwards, there was never a follow-up. And it's like, this is an opportunity that you were lucky to have. This is not an opportunity for everybody. And I really believe if we had the option to have integrated health, I think that would make a huge difference. And so that's the question. I also want to say, we say that this is a sick care system, not a healthcare system. It's very reactive. It's not proactive. How can we work on making sure that we are being proactive about our health? And then lastly, especially for young people who want to study medicine, I went to Cuba thanks to Professor Nims from the University of Minnesota. I love that man. And when I was in Cuba for the 16 nights, it changed my life. And to know that Cuba is sending out more doctors than any other country in the world, they have something going on there, and it is not a failed state. It is absolutely beautiful, even though we're trying to strangle that country out. Thank you so much.
Thank you. Integrative medicine. So I think the problem with integrative medicine is it's not reimbursable enough. I mean, I really think it comes down to money. Integrative medicine programs make money, but they're not as lucrative as some others, even though they are fantastic. I think some of the best physical therapy is integrative medicine specialists who do PT as well. We see as like outcomes and improvement of care because it has that holistic mindset. It literally comes down to the billing, right? Which is getting back to this capitalistic mentality of maintaining our sick care nation, is if we just don't make enough money. Now maybe Bukata can get them to think differently about changing the reimbursement structure. I'm just gonna keep throwing the things that Bukata to fix it. But you're right, like integrative medicine is a great specialty. It's just, I think just the struggle is that systems can't maintain it. Hennepin just eliminated it this past January. It's no longer an option there in Hennepin as well, because it's just not a moneymaker. And that's unfortunate. Was there anything you want to add? And did I hit all 3? Or what was 2 out of the 3? 2 out of 3. What was the third one? Is about changing the sick care to health care. Being more proactive. I think like it's what Dr. Blackstock was saying earlier, is just in putting the money into the preventative strategies and making us be more, uplifting the things that we already have as innovative systems and structures that are there, not needing to reinvent the wheel, but like resourcing the wheel in a way that helps us to live better without needing the healthcare system. So we have to do better at infusing in things that are already there, that are trying to become more preventative, structure-based instead of reaction-based, I do believe.
Yeah, and then your comment about Cuba, I just have to agree with it. You know, actually Cuba for a long time trained many Black American doctors as well.
and continues to.
I think we've got our last question by the gentleman. Yes, thank you.
Hello, thank you for
Hello.
being here. My name is Gage Ravina. I'm the Deputy Director of the Youth and AIDS Project, and this year I was elected or appointed by the governor to be on the African American State Health Advisory Committee.
Congratulations.
And so it is a privilege to serve. But my organization, the Youth and AIDS Project, lives within the medical school of the University of Minnesota. And so that and then the Minnesota Department of Health are two very large, very racist-coded institutions. And so my question is, how do you balance between pissing people off and getting things done?
Oh, we've made whole careers of that.
Because I'm not tenured at the U, so they can get rid of me. So that's my question. Thank you.
Yeah, no, I think it's a very deeply personal and individualized answer. I recognize that I couldn't stay within an institution. I will no longer be able to work inside of an institution. It gives me a visceral response. Like, I can't.
Yeah.
And so I said to myself, I'm pretty intelligent. I could figure a way to work from the outside. But I think I have many colleagues, though, that are still working from the inside, that have been there for decades. They want to be there for the students. They want to be there for the patients. But I think you have to ask yourself, like, is this an environment that is harming me? Is this an environment that is too toxic for me, right? That, I can't sleep, right? I'm losing weight, No, these are the questions we have to ask, because I think that we talked about this. There are people who have died staying in academia. So when I think about me leaving my job, that was a life-saving decision, right? And so I think these are the questions we have to keep asking ourselves. Like, is it every 3 to 6 months? Like, am I happy? Am I able to do the work that I want to do? Am I thriving? Do I have room to advance? And again, those responses are deeply personal. Like, there are people who are like, you know what, I'm staying. And I know for me, when I left academic medicine, I felt so guilty about leaving our students. But you know what they tell me? Oh, Dr. Blackstock, you showed us that there are other ways, that there's not one journey, that there are many things that we can do, right? So thank you. So one thing I think is really important, that we can't always be the martyr. The reason why you can't be the martyr all the time is because you're going to exhaust yourself, you're going to burn out, and you're not going to be able to do the work that you love. So I know there's no right or wrong answer, but there's an answer that is best for you, that sometimes it takes a while to get there.
And I would just add, as someone who makes an entire career of pissing people off by saying the things that need to be said, because they just have to be said, right? It is a burden. It's a significant burden. And not everybody's meant to carry it. And it can make you sick. And you do have to decide, is it something that you're willing to give up and sacrifice a lot for, or not? And I do agree, it's 100% deeply personal. And there's a line you can get to and just be like, that's it, I'm done, right? Like, you don't have to become the latest martyr for the cause. That is not a requirement. Every day that you do something is moving the field forward anyway, whether or not it feels like that, whether you feel like you get your accolades in the moment. Somebody listened and somebody understood, even if you didn't realize that what you were doing. So you have to be really clear on how far are you willing to go, despite them being pissed off, because someone's going to be pissed off. So that's not something we care, right? Like,
yeah, they're ultimately going to be pissed
all
off.
Gonna be pissed
It's just a matter of when.
Yeah, it's all when, right? So it's more related to inside you. How far are you wanting to go for the cause, and at what point do you need to stop and say enough, and have someone else pick up from there and take it to the next level?
It's so true. Like, my therapist, she always talks about, you can tap in and tap out, right? So if you say, you know what, I think I'm gonna just redirect for a little bit. It could be a few years, you try something different, then you come back. Like, you don't always have to leave, but sometimes you do need to take a break and take care of yourself.
Thank you. So we could have this conversation for a lot longer, and I know that, like, all the people are looking at me like, Nneka, wrap it up. So First, I'm going to say a big, big, big thank you to Dr. Blackstock for joining us.
No, thank you, thank you, thank you, thank you, Dara. Thank you. And Dr. Nneka, like, you text me? You were like,
I did.
You texted me a few months ago, and she's like,
I need you to come to Minnesota.
I was like, okay, I'm sure we can make it happen. Yes.
Well, because everybody at the forum was fangirling her, and they were like, we really would like somebody really big like Dr. Uché Blackstock, and I was like, hold my phone. And here she is, so I'm really excited. So thank you so much for coming. Again, so she's going to transition. I think it started pouring, so we moved the book signing thing in, and so she's going to go transition to the green room for a little bit, eat, because we haven't had the chance to do that yet. And then we'll be set up and ready for all of you who got her book for her to do a book signing. So I'm going to excuse you to get started. Thank you, ma'am. Yes, so you can go relax for a little bit. And then it's my joy to bring up, oh, hi, Lieutenant Governor, welcome. Everybody, Lieutenant Governor's in the house, hello. I'm going to bring up Dara again and Shania, who is our CEO and COO of the forum, to help us kind of round this out, and then we will move into the meet and greet section.
Let's please give another round of applause for the fabulous Dr. Nneka Sederstrom and Dr. Uché Blackstock. Thank you, amazing queen doctors, Dr. Queens, so much for your wisdom. Before I pass the mic to my better half, I just want to say thank you so very much. We really hold Ubuntu close to our hearts here at the forum. We are, because you are, and because we are complete. I also just want to say to the folks in the room who are doing the holy work of holding us and our wellness, please don't leave right away, because I don't know if you know, but there are some dope Black people in this room. And some of those dope Black people are humble with it and are quiet with it, and they don't shout about the magic that they're doing. And so, for example, we have one of the most amazing Black food scientists in the world in this room. Where's Lisa? Is Lisa here still? Lisa's back there. Okay. Her beloved Marjorie has been doing body work in Black wellness care for 2 decades. Sitting right next to Lisa is Marjorie. Raise your hand. Is my auntie Dr. Joy Lewis here? Dr. Joy Lewis is in the back. Dr. Joy Lewis has been holding the hemorrhage of Black stress for more years than what I can say, and her book, Healing, is my Bible, and her journal, the act, is it the act or the art, Dr. Joy, of radical self-care. So grab Dr. Joy's book, please. Adrienne Thornton has been at Children's for forever. We have so many amazing, Dr. Destiny Woodruss, who's having events regularly for community around health. I also, again, want to acknowledge our elders. Elder Jackson is on the cover of the Minnesota Women's Press right now. Yes. Jalen, thank you so much for naming what you named about giving birth. I'm trying to hold back tears because I'm a mother of 2, 4, and 6. I had preeclampsia. Gigi was breech, came out feet first. And having a child in America as a Black woman is a life or death decision. And so I just want to say thank you for naming that, and thank you to the beautiful mommy who is breastfeeding her baby in the back. Thank you to mommy, and thank you to baby. I'm so happy that you brought baby here and that you knew that we would hold both of you and that you were in a safe space to nurse. That meant the world to see that happen, so thank you. Thank you to the woman who is here from, is it Chocolate Milk? Thank you, thank you, thank you. And I know I'm leaving out so many amazing stewards of health. Again, Dr. Squires is helping our bodies move at the forum and is doing oftentimes thankless work to have us be well at the forum and beyond. And as a person with chronic back pain and scoliosis and some more stuff, and on blood pressure medicine and all of that, I just want to say, please know that the forum is, again, not an organization that you touch in and come to an event. There are so many ways to tap in, and Shania is about to get into that. So I'm going to stop talking after I say my last thank yous, because I could keep going. But thank you, thank you, thank you, thank you, thank you. Having you here has been such an honor and such a privilege, and I appreciate every single one of you. Thank you. Oh, and Lieutenant Governor, thank you for being here.
Absolutely.
Thank you for being here. And we also have our Senator Esther here as well. And so just know that when you show up, they show up, okay? And when you show up, we show up. And again, Ubuntu, we are because you are.
All right. Well, again, we just want to thank you all so much for being here with us. And although this is the end of the curated portion of our conversation, we want you to leave this room. Don't stop ideating. Don't stop having these conversations, brainstorming. This should be a catalyst and a beginning to these conversations. And not even a beginning, because we know that you've been already having these conversations. So let this be a catalyst to connect with folks that are in the room and to continue these conversations after. It's a comma, not a period. And we're going to continue with this work. So as we close, if we could get everyone to take out their phones, please, and scan the amazing QR codes that you see. If you have a flip phone, maybe just take a picture for later. Somebody can help.
Somebody email it to them.
And so as you're doing that, we just wanted to make you aware of the goodies that we have for everyone in the room. And so you're not leaving empty-handed this evening. In the QR code, once you go in, there will be a link tree that will give you access to take our survey for the event. We ask that everyone give us feedback. Tell us what worked, what maybe didn't work, what you learned this evening. We just ask you for a few minutes of your time to take our survey. We also have access to a toolkit that the team has created to help all of the healthcare providers in the room. And so you'll get access to that toolkit. You'll also be able to opt into Futures Forward Design, which is our Black-centered innovation framework to help with this the future of healthcare and the future of the health work. And then you'll also have access to more reports and findings from the forum. So if you haven't taken out your phone yet, please take out your phone and scan the QR code. And then last but not least, we just ask that you stick around. The bar is open until 8:30 p.m., so you got a few more minutes to indulge. We have coffee in the back. We brought everything inside after the rain. We have a step and repeat, mingle, have conversation, and just again, thank you so much for being with us this evening.
Thank you. Thank you, thank you, thank you. We did ask Lieutenant Governor if she had a few words that she wanted to leave with the room, and she has so graciously so graciously said that she wouldn't mind saying some words to the room. And so we'd like to welcome Lieutenant Governor Peggy Flanagan. All right, bring us home, Lieutenant Governor.
Well, I know that I'm standing between you and socializing in the bar, so I'll make this quick. But I will just say, I'm so grateful for this room and for the forum. I come to this space as an Indigenous woman who watched as her father had his leg amputated because of diabetes, and was later told at a different hospital with a different physician that that might not have needed to have been done. I come to this space as someone who brought our traditional medicines into my room as I was about to give birth to my little girl, and was told by the nurse that I couldn't have drugs next to my bedside. And as someone who had preeclampsia, just doing the best I could in that space, and having to simultaneously advocate for myself when I just wanted to have a good birth experience, to welcome my baby into this world. So that has been my experience, but my job is to do everything that I can to listen to your experience, and to be clear about the collective wisdom that is in this room, and the traditions of how we have cared for our own communities for a very long time. I've been looking at Dr. Sederstrom's research. I'm a nerd, and so I like to dig in. But the things that are there should come as no surprise to folks, right? People can't access health care because they can't pay for health insurance. And what if we actually just focused on how to get people health care, right? And when we know that there are obstacles, not necessarily in people wanting to seek that care, but there are so many obstacles that are in the way. And all of our systems that have been set up not to treat individuals, right, as individuals and as whole people who are part of whole families and whole communities, but we literally are treating people as if they come in pieces, right? And that is what is broken about this system. So I know there is so much more that we can do and we can do together. And people who are tiptoeing around and saying, we're not going to measure this, we're not going to measure that, we're going to pretend that disparities don't exist. We measure what we care about. And this is the time to lean in and to stand up with each other and to fight for the things that we know work. Because the qualitative data tell us so, and the quantitative data tell us so. So while things are rough and people are trying to tell stories that are simply their own stories that are not informed by the experience of real people, I want to be here to help amplify the stories, to push for the resources, to do the work that we know just works. So I am grateful that you would allow me some time to be here with you tonight. I look forward to visiting, but thank you to the forum for the work that you've been doing for a long time. May this work continue into the future, but may we also make sure that there are more leaders who are speaking on their own behalf, who are the decision makers in the seats, who are making the decisions, and that we talk about remember when we had these disparities. Remember when, and look forward to that time, and with gratitude for all the work that has been done and all the work that we will do in solidarity and partnership together. Chimigwech, thank you so much.
Thank you for joining us this evening for our Future as Well. We encourage you to purchase New York Times bestseller Legacy, A Black Physician Reckons with Racism in Medicine by Dr. Uché Blackstock. Thank you for coming today. Stay for the conversation and libations. And we also encourage you to scan the QR code. So make sure that you swipe the QR code once you scan it. Thank you.